Greetings, everyone. My name is Chad Jackson, and I am the University of Alabama's Black Faculty and Staff Association President. On behalf of our executive board, our members, associates, and friends, we welcome you to the BFSA webinar on systemic racism and COVID-19's impact on mental health, in partnership with the UA Division of Diversity, Equity, and Inclusion and the College of Continuing Studies Conference Services. It is with great honor that we have with us today the Honorable Dr. Charles Steele Jr., Dr.Doris Vaughn, Mrs. Janice Palmer, all who will be formally introduced at a later time. I take this opportunity to welcome you now to greet us, Dr. G. Christine Taylor, Vice President and Associate Provost for the Division of Diversity, Equity, and Inclusion at the University of Alabama. With nearly 30 years of experience, Dr. Taylor joined the University of Alabama in August 2017, and she has been trailblazing ever since. Welcome us now, Dr. G. Christine Taylor.
Thank you, Chad. Let me say good afternoon, and I'm honored to be able to bring greetings to all of you on behalf of the University of Alabama to this webinar that's focusing on such an important and critical issue. The events that we've all collectively experienced since mid-March, and most recently with the loss of C.T. Vivian and our Congressman John Lewis, have been overwhelming. And it's come to my mind, resident, the second verse of Lift Every Voice and Sing. Stony the road we trod, bitter the chastening rod, felt in the days when hope unborn had died. Yet, with a steady beat, have not our weary feet come to the place for which our fathers sighed. I've thought a lot this weekend as I've watched us pay a most important respect to Congressman Lewis. And I read one of his quotes that really has inspired me and perhaps will inspire you as well. As we look at the heaviness of the conversation to be had today, do not get lost in the sea of despair. Be hopeful. Be optimistic. Our struggle is not the struggle of a day, a week, a month, or a year. It is the struggle of a lifetime. Never be afraid to make some noise. Get in good trouble, necessary trouble. As I think about that for my own life, I am forced to consider what must I do at the individual level to be able to be in good trouble and stay into good trouble. And that takes me to the critical part about how do we manage as African Americans at this point in time. And I'm drawn to the words of New York's poet laureate in 1991, the writer, the librarian, and the civil rights activist, Audre Lorde. She said, caring for myself is not self-indulgence. It is self-preservation. And that is an act of political warfare. I'm confident that today's workshop, today's webinar, will give us some things to think about relative to the command that Congressman Lewis has left us, as well as the importance of us engaging in self-care. Please enjoy this seminar, and many thanks to our leadership of the Executive Board and the membership of the Black Faculty Staff Association. We greatly appreciate your time. Thank you.
Thank you, Dr. Taylor, for greeting us today in those awesome words of welcome. I now introduce BFSA's very own Ms. Janice Palmer, BFSA's Chair of Faculty and Staff Professional Development Committee and University of Alabama HR Learning and Development Workforce Development Specialist. She will moderate our program today. Let us all welcome Mrs. Janice Palmer.
Thank you, Mr. President. Our first presenter today is Dr. Charles Steele. Dr. Steele is standing in the footsteps of Dr. Martin Luther King Jr., Dr. Ralph Abernathy, and Dr. Joseph Lowry, as he continues the work of the Southern Christian Leadership Conference, SCLC. Charles Steele Jr. was born on August 3rd, 1946, in Tuscaloosa, Alabama. He is president and CEO of the Southern Christian Leadership Conference, SCLC. Dr. Steele is a civil rights leader first, using his constituency as a pulse to direct action and chapter development of public policies. His vision is a national playing field, keeps him in touch with current issues and political fairness. In 1985, Dr. Steele was elected to the Tuscaloosa City Council, where he served 2 terms. His dedication to serving his constituents is evident through his many worthwhile, tangible accomplishments in Tuscaloosa County and West Alabama. During his tenure as city councilman, he organized Unity Day Scholarship Fund, the Tuscaloosa Police Athletic League, and secured funds for the purchase of Palmore Park and Bars Quarters, Charles Steele Estates. This was the first low-income, no down payment home ownership program in West Alabama. He obtained the funds to build the Bernice Washington Insight Center, a drug treatment center. He organized a drug task force and many years of relenting efforts, the Partners for a Drug-Free Tuscaloosa County, formerly Tuscaloosa Drug Task Force. During that time, the partnership was awarded $1 million. In 1994, Charles Steele Jr. was elected to the Alabama State Senate. As senator, he played a key role in recruiting Mercedes-Benz to Tuscaloosa County. He also recruited several new plants in his district. He was instrumental in locating Tire and Wheel Assembly, TNWA, in Greene County, H&H Truck Bed in Perry County, and Green Cove Dimensions Incorporated Drumsticks in Greene County. He also sponsored a non-traditional educational program with Robert Townsend of Hollywood, California, for the youth of his district. He was serving in his 3rd term before resigning to become the national vice president of the SCLC, the Atlanta-based organization co-founded by Dr. Martin Luther King Jr. In October 2000, Charles Steele Jr. was elected as a Senate member of the High Chamber U.S. Parliamentary Group of the International State Parliament for Safety and Peace. The International Parliament nominated Dr. Steele to the Ministry of American Affairs on the 15th of March, 2001. In November 2004, he became the president and CEO of SCLC. In April 2006, Charles Steele Jr. was inducted into the Martin Luther King Jr. Board of Preachers of Morehouse College. On April 20th, 2006, he was inducted into the Tuscaloosa Hall of Fame in October of 2006. In 2009, Dr. Steele resigned as SCLC president and CEO to start his own consulting firm, Charles Steele and Associates, CSA. In 2011, the board of SCLC unanimously voted Dr. Steele as president emeritus. On July 2nd, 2012, he was elected chief executive officer for the 2nd term. In August 2013, Dr. Steele made history by becoming the first SCLC president to serve in this position as CEO twice. In January of 2018, Dr. Steele was inducted into the International Civil Rights Walk of Fame. In September 2019, Dr. Steele was inducted into the National Black Colleges Alumni HBCU Hall of Fame. Charles Steele Jr. graduated high school from Druid High in Tuscaloosa, Alabama, and attended college at Mississippi Valley State University and Oakland University. He received his bachelor's from the F.T. Bozeman School of Ministry and Global Evangelical Christian College of Louisiana. He also received his master's from F.T. Bozeman Global Evangelical Seminary and received an earned doctorate degree from Mount Carmel Theological Seminary. He also holds an honorary Doctor of Human Letters degree from the prestigious Thelman College in Tuscaloosa, Alabama, an honorary doctorate of Christian education from the F.T. Bozeman School of Ministry and Global Evangelical Christian College of Louisiana, honorary doctorate from Mississippi Valley State University, an honorary doctorate from Birmingham Bible College, and other numerous honorary doctorate degrees. Throughout Dr. Steele's many travels, he has visited 5 continents and countless countries. Some of his most notable visits include Jerusalem, Israel, Moscow, Russia, Berlin, Germany, Rome, Italy, and many countries within the continent of Africa. He and his wife, Kathleen Annette Steele, are the parents of 2 daughters, Lakeisha and Charla, grandsons, Carson and Cruz, granddaughter, Harper Grace, and son-in-law, Cleveland. Dr. Steele is also co-owner of Van Hoos and Steele Funeral Home. Please welcome Dr. Charles Steele Jr.
Thank you, Ms. Palmer. Can you hear me?
You're welcome. Yes.
Okay. Thank you so much for the introduction. Wow. I began to think that was someone else you were introducing. Because many times you don't realize how busy you have been and many of your involvement in terms of what we do. First of all, this is a topic that's dear to me, and being in the position of Dr. Martin Luther King Jr., I understand the globalization and the significance and importance of keeping the dream alive. Racism is something that is very uncomfortable for most people, black, white, green, or blue. I know this because I speak all over the world, and I don't hesitate to talk about it or to deal with it. The systemic racism that we encounter within America, many times when I speak, I can say things other folks can't say because I'm called to do this. I've been anointed to do this. And my philosophy is that if God calls you to a certain position to have a purpose in life and to be a change agent for the betterment of society, you have no choice but to do it. And you put your life on the line. Many people don't understand the systemic racism, and I'm gonna say it, in this country, is what carried out Dr. King. That's why Dr. King was killed for 2 reasons. his opposition to the Vietnam War, and also the Poor People Campaign. That's why he was assassinated. Dr. King also said that this country is the enemy, and we must not be afraid to deal with the facts. Many times I get challenged in terms of what I say, and that's the position I'm in. I don't worry about that. But over 401 years ago, this country was founded upon white supremacy, and it still is alive and well today. In terms of the fact that when we came through the transatlantic African slave trade, it was built upon racism. I want to suggest to you, in talking about systemic racism, that you read this book that's called The Color of Law by Richard Rothstein. The Color of Law. It talks about every aspect of the conspiracy of keeping African Americans, Black folks, colored folks, Negroes at the time, to keep us as second-class citizens after we were abolished from slavery. But we came over in terms of the historicity of our background, in terms of to build this country with free labor. And I want to stop right here to commend Asheville, North Carolina, roughly 10 days or so ago, when they created within that city a reparation program. Reparation simply means repair and make up for what you have done. And in Asheville, North Carolina, unanimously, the city council passed a resolution where they're going to bring about affordable housing, they're going to create Black entrepreneurship, and they're going to bring about the awareness and the affordability of healthcare and the lack of the awareness of healthcare for people of color. It's all a conspiracy in terms of African Americans, ex-slave, former slaves, being put in their place, as they call it. In this book, and I recommend it again, it's being redundant, but I recommend again that everyone that can hear me or listening or see me at this moment, please read this book. It talks about from day one in the early 20s in terms of the federal government and the state government and the local government conspiring to saying that we're not going to let African Americans have any ownership. They will be subjected to second-class citizens at the best. And many times I could say, I did that on my TV show, and we were talking about the 1965 Voter Rights Act, which many people don't understand today. You're talking about my good friend, Congressman John Lewis, and C.T. Vivian. C.T. Vivian and I worked together for many of years. I met Dr. C.T. Vivian when I was 16, 17 years of age in Tuscaloosa, Alabama, at First African Baptist Church, when we was integrating the county courthouse and the public facilities, particularly the parks. We were integrating in the Ku Klux Klan and other element of segregation and racial discrimination and racism would call us the N-word. They would bring out their pistols. They would tell us to go back to Africa, and some of them spat on us. But it was C.T. Vivian who was training us in the aspect of nonviolence. Nonviolence is the only way for us to bring about change. And I want to quote Frederick Douglass, who said, "Power concedes to nothing without a demand. It never has, and it never will." I'm gonna say that again. Power concedes nothing without a demand. It never has, and it never will, unquote. Frederick Douglass was talking about politics can't change you. You have to change politics. I speak in Washington, D.C. every 2 or 3 months. I'm on the Hill, not Stillman Hill, but Capitol Hill, talking in terms of what's going on. And I'm talking to the U.S. Senate staff, as well as the U.S. House of Representatives staff. And it's always overflowing because I deal with facts. And when I'm there, I'm so blatantly amazed at the number of people who do not understand the historicity as well as the facts of today in terms of systemic racism. 1965 Voter Rights Act. Let me talk about that just for a moment. And you heard a lot of talk about that with the Congressman John Lewis, who has spoken for me many of times in Tuscaloosa. And also we are in the movement together. He's spoken for us here in Atlanta, and he's going to be a loss to this community and to the world. But we all must pay that price. And what I'm saying in terms of the example of Congressman Lewis and Dr. C.T. Vivian, whom I had an office right next to C.T. at the national office of SCLC, National International Office, for over a year and a half. And if you ever want to hear a storyteller, you give yourself up one whole day because he won't let you go. And he would tell you the whole story in terms of his experience in the civil rights movement. And I thank God that I'm honored today to have known not only Dr. Vivian, Congressman John Lewis, but many other leaders like Dr. Joe Zalari. Had the opportunity to meet Dr. Martin Luther King Jr. as well, and many, many others, Dr. Abernathy, and the list goes on and on. Reverend John Nettles, who actually got me into SCLC in telling me that one day I will be the president of this great organization that Dr. King led and was very successful in establishing freedom and justice and harmonious working relationship around the world. 1965 Voter Rights Act. Basically what it was all about was a protection from the federal government. Section 4 and Section 5 of the 1965 Voter Rights Act has been gutted. See, every time we accomplish something, there's always the enemy on the other side figuring out within a very short period of time how to take away your accomplishment. As soon as we got the 1965 Voter Rights Act, there were people going to work on removing and rescinding this particular gift from God in terms of what was delivered through the 1965 Voter Rights Act, which people shed blood, they were lynched, they were tortured, like Emmett Till. God bless his soul. I knew Miss Mamie Till Mobley, good friend of ours. And all of this led to Mrs. Rosa Parks in 1955. It was all planned, y'all. It was no accident. Her feet wasn't that tired. She had planned and was trained to take on that assignment, which Miss Mamie Till Mobley opening up the casket of Emmett Till. And in Jet magazine, I can see it today, where this young man was tortured by the Ku Klux Klan and other mean-spirited folks. And this led to the modern day civil rights movement because it motivated Mrs. Rosa Parks, which brought about the opportunity for none other than Dr. Martin Luther King Jr. So in almost closing, I'm not there yet, I'm almost there. In 1965, with the Voter Rights Act, it's something that disturbs me in terms of the impact of why we, and I lead a march every year, 54 miles walking and marching all the way from Selma to Montgomery, reenacting that march every 5th year. We do that every 5th year. I just did it this year with my wife. And the point being is that I get very disturbed when that march in 1965 did not come about initially the Voter Rights Act of 1965. See, many people don't know the history in terms of many of the things that took place in the civil rights movement, because emotionally we get caught up on what we see. But I'll be remiss if I didn't mention the name Jimmy Lee Jackson. That march came about because of none other than Mr. Jimmy Lee Jackson, who had just gotten out of the service. And it was in Marion, Alabama. It was not Selma. It was Marion, Alabama, where the movement with James Orange and Jose Williams, they were the ones who hit the ground with my chairman of the board, Dr. Bernard Lafayette, who's my chairman today, who's also teaching at Auburn University. I got him from the University of Rhode Island to Emory. We have a relationship at Emory University. He taught there for 6 years in terms of the Kenyan philosophy of nonviolence. Now he's at Auburn. Hopefully the next move would be at the University of Alabama in Tuscaloosa. He is so knowledgeable of historicity of the civil rights movement because he lived it. And once you live a certain purpose in life, of experience, that's when you get your wisdom, which all wisdom comes from God. But he allows you to have opportunities of experience. So with Jimmy Lee Jackson, they had a situation in Marion and Selma where they were participating in registering to vote. Dr. C.T. Vivian was there. My chairman of the board, Dr. Bernard Lafayette, he was there 2 years. Just showing you the back of systemic racism within our society, in particular with the Dr. Bernard Lafayette, my chairman of the board, was in Selma 2 years prior to the march from Selma to Montgomery. And many people were afraid to go to Selma, as Dr. Lafayette did his research. And I asked the question, why, Dr. Lafayette? He said, because in doing my in-depth research, we found out that the white people, the white folks, was too mean. And the colored folks, black folks, African Americans, were too afraid. They were too afraid to get involved. He said, that's why I stayed there 2 years. Amelia Boynton, can't forget that name. Amelia Boynton, who was on that same bridge with Congressman John Lewis at that particular time in 1965. Albert Turner, Sr. Now, the fact being is that initially, because we've been getting a lot of exposure in the last 7 to 10 days in terms of the Voter Rights Act. Initially, that march was planned out of Marion, Alabama, and then they say, well, Selma is a direct conveyance, and we can go directly to Montgomery and put Jimmy Lee Jackson's body at the foot of the steps of the Capitol of Alabama to Governor George Wallace. That was the initial plan. Jimmy Lee Jackson, don't forget that name, was killed, was murdered by the Alabama state trooper. And the reason being is that when they were registering to vote, the state troopers came in and they had planned to kill none other than Reverend James Orange. But at that time, they were trying to impress black folks and put the fear in them that you're not going to register to vote, you don't qualify, you're not a citizen, you just a slave. That was the impression that they wanted to give. You're still in slavery, you're in Jim Crow. It's Jim Crow era. So at the time, when they were trying to register to vote, the state troopers ran them into this cafe. They ran them to this black cafe next to Lee's funeral home there in Marion, Alabama. And this sheriff was attempting to beat Jimmy Lee Jackson's grandmother with his baton. And Jimmy Lee got in the way, put his hand up, and he stopped the blow from going to hit his grandmother. And that's when the sheriff shot him and killed him right on that spot. So within a matter of hours, they said, they being the people who was in the movement, and the impact was on Marion, Alabama, which is about 18, 20 miles from Selma, I would imagine. The plan was to take his body from Lee's funeral home to Selma on Highway 80 and go all the way. Dr. King was not involved that time. You know who marching was? None other than Reverend Jose Williams. And SNCC was fighting SCLC at that time. It's always, you know, and that's just part of life. It's always a different philosophy, a different method, and people try to outshine, out front you in terms of their way or approach is better. So that's how Congressman John Lewis got involved. Reverend Jose Williams, being the genius that he is, discovered that Congressman John Lewis at that time was in town, and he was trying to make amends to some degree with SCLC, and he was a part of SNCC. But that brought about an opportunity. And thank God for Reverend Jose Williams. He included Congressman John Lewis at that time. He said, come here, my brother. We want you to be up here with us. It just didn't happen by osmosis. This thing was planned, and to bring about the illustration of collaboration. That's one thing we have in terms of fair-minded thinking people, all people, and Black folks. We don't have enough, if any, collaboration. That story must be told for many of years, how Congressman John Lewis and Reverend Jose Williams came together. There was SNCC and there was SCLC. They came together because they were at odds at the time in terms of which approach should we take. So I could go on, but let me close with this. The 6 Steps of Nonviolence by Dr. Martin Luther King Jr. I teach this all over the world. People will cut off their right arm to get this training in terms of the 6 steps of nonviolence. And I think you need to write it down. This can save marriages. This can save countries. It can save universities, institutions all over the world. And matter of fact, it can save the universe in terms of having the thought process and the training in terms of the Kenyan philosophy, the 6 steps of nonviolence. Number 1, information gathering. That's the facts. Like I have researchers. I know 32% of Black children in this country live in poverty. 32%. 11% of white children, 26% of Hispanic, but 32% of African Americans. Let me give you another fact. 60% of Black wealth has been abolished from the Black community, has been rescinded, has been removed, not there anymore. What's our Black wealth? Our homes. We've lost 60% of our Black wealth. We have nothing but our homes. We don't have no automobile manufacturers. We don't have no Coca-Cola plants. We don't manufacture any products. We just have our homes. And we lost 60% of Black homes. The first of the month, 14 people will be evicted. Got the facts. will be evicted, not from their homes. We already lost our homes. Will be evicted from rental units. 14 million people at the first of the month. And America, you mean to tell me with $100 trillion that you could invest in poor people and people of conscience who love this country, but you're not showing any love to us? I go back to what Frederick Douglass said, power concedes nothing without a demand. We have to demand for this country to do what is right. Information gathering, that's what I'm doing. Then when you get it, I'm also doing number 2, education. You educate people in the community on the information and the facts that you have. That's number 2. Number 3, personal commitment. Still, what do you mean about that? What I mean about that on personal commitment, you are willing to give your life to make sure that you do your part. See, the worst thing about I'm thinking in terms of death is that I don't fulfill and have the fulfillment of the purpose of why God put in position. And along the way, what did I do to help make things better? I'm not afraid of death, but I am afraid of not fulfilling the anointing want me to do. And I've been in this position for over 13 years. Took a 3-year sabbatical, came back, serving 2 terms. Only president at SCLC who ever served 2 terms. And it's not an easy job, but it is easy if God anointed you to it and you believe in helping folks and you understand the endangerment that you have, even to the supreme sacrifice of losing your life. It doesn't matter. Number 4, listen to me, I hope you're writing it down. Number 4, negotiation. Negotiation. You don't do number 5, which is direct action. Number 4, negotiation. Number 5 is direct action. Many of the moments of protests going on today put in 5 as number 1. See, one thing that Dr. King believed in, C.T. Vivian believed in, Congressman John Lewis believed in, was training. Before you march, you must be trained at least 4, 5, 6 days before we march. We got to have marshals to make sure what's going on today, you don't have anyone with the intention of violence coming to disturb your nonviolent march. It's all about being nonviolent. That's why Dr. King was killed in Memphis, Tennessee. He was killed in Memphis, Tennessee because and that wasn't his march. That was the sanitation workers' march, which wasn't his. AFL-CIO, the union was involved with that. And they asked, Dr. King got off his schedule because he knew it was an endangerment for him not to plan his every move. But in this, when 2 or 3 of his friends said, Doc, we need you here. And when he went, he did not have the time to train and plan the marchers and the people who were going to be in the march. It turned violent, ladies and gentlemen. The invaders. The invader was a Black gang in Memphis, Tennessee. They were bought off, for the lack of a better word, they were bought off by the federal government, the FBI. And the FBI got them to come in and interfere and to make the march violent, very violently. And they were staying at the same motel that Dr. King was staying at. And originally, that's Lorraine Motel. Originally, I'm talking about systemic racism is all in this message, I'm telling you. Dr. King was not originally staying at the Lorraine Motel. He started doing all this integration. We brought about all these opportunities. And we thought integration was going to change all of this. We missed the boat. And Dr. King recognized that at the end of his life. He recognized we did not include economics. We thought integration was going to bring about the change. And we were so wrong. But he was staying at an all-white hotel, Holiday Inn in Memphis. And some representative from the government had a relationship with one of the newspapers in Memphis, and they made a headline and a point to say, Dr. King has left colored folks, African Americans, Black folks, and he over there with the other folks. Wanted to frustrate him. You know why? They want to push him to the Lorraine Motel. Why? Because they could get a better shot. And it was headlined, Dr. King leaving his people. So he went to the Lorraine Motel, and the rest is history. I will tell you about the ending of that story, which you need to know, and most folks don't know. And the reason I know, Lord bless her soul, Mrs. Coretta Scott King, in 1999, sued the federal government, it's public information, sued the United States of America government for $1 because she said James Earl Ray did not kill my husband. It was the government. And they had a hearing in the circuit court there in Memphis, to see if there was enough evidence to come out of this hearing in the circuit court to move forward, because her goal was to go all the way to the US Supreme Court. That jury for 30 days heard all the evidence, and I won't go into it at this moment, but they came out unanimously. Mrs. King should take it further to the federal government, to the appellate and up the US Supreme Court. She should appeal this because we think she has proven that James Earl Ray didn't kill her husband. It was systemic. How can you talk about systemic racism and you don't talk about who killed Dr. King? I will be a hypocrite to sit up here and voice my opinion on this discussion. In closing, Black Lives Matter, I love you. Great concept. But Black Lives Matter has no structure. Totally opposed to what we would, Dr. King led us to be in terms of the civil rights movement. There are people who will get involved with the civil rights movement for the purpose of misleading what you have already accomplished and what your goals and approaches are. They want to bring a hidden agenda to the table. And I'll just leave it at that. We are not going to participate in that's violent or violently being approached. It's all about nonviolent. And that's what we were taught, and that's what we're going to do. There are some hidden behind some of the voices here. See, you have to have substance, and you have to have a conscience of doing what's right. So thank you so much for having me. I didn't tell you number 6. I told you about direct action. That's number 5. Let me close out with number 6. Number 6, I usually leave number 6, number 5, and 6, because I tell folks, I'm not going to give you any more. If you want any more, you got to call me back. Let me speak again. But since I know Dr. Vaughn and many, Miss Palmer and many others of you that's involved with this, I'm going to give you all 6. Again, direct action. And many people using that today in their protests as number 1. No, you should get the information, gather, educate the people, have a personal commitment, and understand the purpose of negotiation. You have a problem right there in Tuscaloosa, Alabama, with a well-established federal institution. I won't go into it now, but you're going to hear more about that because I'm taking that on in terms of one of the worst discriminations that anyone could go through. I wish I could tell you the whole story. In Tuscaloosa, you have that. And I'm saying, what are we going to do? Dr. King also said, silence in the face of evil, my Lord, is evil itself. If you remain silent and you don't support the right cause of justification of doing the right thing, of freedom for all God's children, then you're just as guilty. You're just as guilty as the racist system. Number 6 is reconciliation. Reconciliation. You always reconcile. Always reconcile. In closing, I would say, for those of you who are not familiar with the facts that I'm talking about, Black families make on the average 10% of what white families make. Wow. Isn't that something? The average Black family make only 10% for the average white family makes. 10%. So as we close, my question to you is, what are you going to do when 75% of the people in this country without the pandemic, before the pandemic, 75% of the people that go to work every day lives from check to check. 50% of people, Black, white, green, or blue, 50% of people that owns a checking account, 50% cannot write a check over $500. Majority of the people in this country cannot afford a $250 emergency bill. Ladies and gentlemen, we have some serious problems. And remember this, politics ain't gonna change. You have to change politics. Thank you so much.
Thank you so much, Dr. Steele. You've provided for us a wealth of information and knowledge, and you did it in a way that was passionate, because this is your passion. And you spoke from your heart. And these are things that we all needed to hear. And we regret that we could not have a Q&A for you, but we will do a follow-up with you to provide more information to our group and some follow-up on our website as well. Thank you for your time.
Thank you so much. Thank you for having us.
Thank you. Okay, our next presenter is Dr. Doris Chambers Vaughn. She's a licensed professional counselor in Alabama and Georgia. Her doctorate degree is in counselor education from the University of Alabama. She is currently an adjunct professor at her alma mater after serving as clinical faculty and as director of clinical services. She earned a Master of Science degree in counseling and psychology, Troy University, 2007. Dr. Vaughn is an international faculty member of Portland Institute of Transition and Loss. Dr. Vaughn's list of accomplishments is very lengthy. She is the recipient of national and statewide awards, including the Alabama Counseling Association's Outstanding Practitioner Award and the Wilbur A. Tinter Humanitarian and Caring Person Award. She is also a published author and researcher. Dr. Vaughn owns a private professional counseling practice, Tuscaloosa Center for Cognitive Therapy, and has counseled more than 2,000 clients. Services include professional counseling, support groups, facilitation, professional presentations, consulting, and training. Dr. Vaughn is also a registered nurse who practiced for more than 22 years in the areas of oncology, home health, palliative care, and hospice. Dr. Vaughn is the mother of 3 children, Tiffany, CJ, and Leo, and the grandmother of 7 grandchildren. She is a member of Bethel Missionary Baptist Church. Her hobbies include reading, watching Alabama football, and spending time with family and friends. Please welcome Dr. Doris Chambers Vaughn.
Good afternoon, everyone. I am indeed excited to be here to have this opportunity to share with you about mental health during these concurrent crises that we have. And so thankful that Dr. Steele was able to be with us and present on systemic racism, which is a big part of why we are all stressed out during these times. Now, one morning, but not this morning, I was able to wake up with some sense of control over my life. I could choose to have my morning coffee. I could watch the morning news or watch at it, not really paying close attention. My grandchildren could go into the school to receive their education. I could go into the office to work. I could go after work into a restaurant of my choosing to share a meal with friends or family. That was before my sense of safety and security was compromised by the coronavirus. One morning, but not this morning, there was no COVID-19. I was not in a fight for my life with an invisible opponent. There was no need for me to have a front row seat to systemic racism. Well, I've kind of always had a front row seat. I'll take that back. My life has been in a position of a front row seat. I have lived it being born during the Civil Rights Movement. However, it wasn't playing on the television over and over and over every time I turned the set on. Now, I am accustomed to stress, as are many of you. Life has so many losses that create stress, loss, great, sudden, inexplicable, unfair loss. It's everywhere and it's unavoidable. Right now, we are experiencing many losses around the world as we deal with systemic racism and COVID-19. I have never, and maybe you haven't either, experienced anything like this magnitude of stress concurrently in my lifetime. Predictability has been replaced with so many unknowns. Mental health around the world is in jeopardy. We are now coping with COVID-19 cases. If you don't know of someone, you have personal family and friends who are suffering from COVID-19. Many of us, and you included, have had losses of family members. Some people, multiple family members. Unemployment rates skyrocketing, economic distress and all of the pain that goes along with that, commonplace. Businesses and schools are closed. George Floyd's death only highlighted one part of systemic racism. Macroaggressions and microaggressions are a part of our everyday lives, every day, every hour, every minute, and sometimes every second. We cannot get away from what we are having to experience as it relates to stress during this time. We are now witnessing worldwide protests, some peaceful, some not. But we're looking, it's on the television every time we turn it on, but we're not hearing. Right. We're judging, yet we're not attempting to understand. That creates an even greater problem and even more stress for us to deal with and cope as we go through this time. In response to the protest, an individual said to me, well, you know, in the good old days, we had a butler. That's when everything was peaceful and everyone got along. Really? That's all I could say. However, I won't go there. Dr. Steele has done a magnificent job addressing systemic racism, but I want you to know that all of these things have a great impact on our mental health and well-being. One morning, but not this morning, we may all go back to some sense of normalcy. We may feel like we have some control over our lives, and our sense of safety in the world may be restored. But in the meantime, we all need to make our mental health a priority. None are exempt. Every facet of society and the way we live is feeling the impact of this dual crisis. Whether we are faculty members, school is getting ready to resume, colleges and schools. Colleagues, I have a colleague that called me. She is completely stressed beyond out. She works in mental health. She has a doctorate degree in counseling. She knows how to manage, yet even she is succumbing to the stress of these times in which we live. Students, all of my students that cancel when they go home for summer are calling me anticipating coming back because they are experiencing so much anxiety. They're ready to return because parents are overbearing. Parents are saying, no, don't go back. Students are saying, I can't wait to get out of there. But at the same time, they're stressed out. Administrators in every profession and every segment of society, and lay persons as well. We cannot forget even people who are not as educated as we have the good fortune to be, are all experiencing the same stress and level of distress right now. We all have a level of fear, frustration, worry, anxiety, and depression symptoms. What I want to help you with today is to answer the question, is what I am experiencing normal, or is this pathology? Is it normal? Can I validate for you what you are experiencing? Or is it pathology? Too many people are seeking mental health care during this time for something that is normal and can be empowered to manage. The problem is we don't have enough knowledge in general, in the general public, to know if it's normal or not. I also want to empower you to make your mental health a priority by engaging in healthy mental self-care. Because there are times in our lives, everyone experiences this, depression and anxiety, and both are normal and expected. When we lose loved ones, we expect it. When we lose jobs, we expect it. We go to the doctor and we get a new diagnosis or a new medication, and oh my, I'm over 50 now, right? So there are things that are normal, but we don't recognize it as being normal. There are distinctive differences between clinical depression and clinical anxiety and situational normal symptoms of depression and anxiety. Too many people are running to the doctor. Too many doctors are handing out medications that are not needed based on anxiety and depression that are appropriate for what we're going through. The difference is the impairment in your ability to function. If you are feeling anxious, well, you have a good reason. If you might be fearful of COVID-19, well, you have a good reason. I have a sister who has health problems. I worry that she may somehow come in contact with the virus. That's normal. That's healthy. That would strive me to make some changes and to implement something that would address it, not just only allow the fear to make the decision for how I respond. Loneliness. Many people are dealing with loneliness and isolation. Ever since back in March when this started, and fear everywhere because the television was over and over, and all we would see were those numbers going higher and higher. People were fearful. And when we had the stay-at-home order, now being alone has translated into loneliness. Not everyone has the resources or the technology to stay connected. Many people are at risk, and so they are isolated. The churches were closed and still are mainly. So any interactions and opportunities for social engagement were gone. Worry, sadness, impatience. How many of you have said yourself, I know I have, but I know many of you have also said, I am over this already. I cannot wait for things to go back the way they were. Well, probably newsflash, it's likely not going back the way it was. We'll have a new normal, but back to the way it was, I might as well make friends with technology. This is here to stay. Ugh, I just pinched myself. That hurt. But I will do my work and learn to manage it. Grief. A lot of us are grieving losses as we move through this period. Well, I want you to try and get from this presentation today, as it relates to normalizing what you're going through and validating your experiences, get a different kind of relationship with your thoughts and your emotions. That's where the problem lies. That's why we have ever increasing numbers of people who are suffering